and then we'll get started right away. So first we're going to hear from Jessica Rose-Malm, who's the Senior Health Policy Manager at Childcare Aware of America, and she's just going to give us a brief overview of why Childcare Aware of America is seeing safe siting as an important issue and enough to co-host this webinar. Then I will be conducting the bulk of the presentation and kind of getting into what safe siting is, why we should be taking precautions and be careful about choosing safe places for child care facilities, and look at a couple specific states and how they are working through their own programs or initiatives. Finally, we're going to hear from Maggie Lopez, who's the Child Care Education Director at CCAoA Resources in Monmouth County in New Jersey. So with that, I'll hand it over to Jessica. Thank you.
Hi, can you hear me, Kathy?
Yes, I can. Yep.
All right, thanks. Hi, everyone. I'm so glad to be here to share a little bit about Childcare Aware of America's approach to health and how we're working with incredible partners like the Children's Environmental Health Network to make childcare a healthier space for all kids to learn and grow. I'm so thankful that CEHN reached out to us to partner on this webinar and to share their safe siting work with our members. And I'm really excited that Maggie is here to join to share some of her experiences on the ground supporting child care providers in New Jersey as they work to put environmental health policies into practice. So I'm going to get started just by giving you a little bit of background on health and health policy here at CCAoA, so you'll have an idea of how choosing safe spaces and environments fits into the work that we're doing. For most of our history, CCAoA has focused on advocating for minimum health and safety standards in childcare, including things like background checks, provider training, common sense regulations, and monitoring. In 2014, the Child Care and Development Block Grant was reauthorized. If you're not familiar with CCDBG, it's the main source of federal funding for child care subsidies, and in a lot of ways it dictates how states think about child care supply, health, safety, and quality. With the 2014 reauthorization, much of what we'd been advocating for was included, which was a huge win. And it also meant that CCAoA had to kind of quickly switch gears to focus on how best to support states and our members, child care resource and referral agencies, in implementing the new CCDBG requirements. And while implementation of the minimum requirements has been a bit of a rocky road, and there's plenty of work left to be done on that, it's also given us the opportunity to start thinking beyond traditional definitions of health and safety and explore some new areas of health and childcare. So this slide just shows the 4 big buckets of health topics that CCAoA's health policy team thinks about now. Safety and environment covers some of the traditional health and safety topics like injury prevention and safe sleep, as well as some other elements of environmental health like air and water quality. Nutrition, breastfeeding, active play, and screen time are some of our core areas for health promotion. And then the last bucket is inclusion, covering kids with disabilities, special health care needs, as well as mental and behavioral health. Our health policy team is working on projects across all of these issue areas to support responsible policymaking and help child care providers make their programs healthier for kids. So lately we've been thinking about health and safety in a sort of new way. A lot of times when we think about safety in child care, we think about the hazards that we can easily observe. Are there working smoke detectors at a center? Are hazardous chemicals locked away? Are kids kept out of the kitchen and away from hot pots like this sweet little one? So we can see those hazards. We know they're unsafe. But what if there's lead in the drinking water? You can't see that. Or what about exhaust or fumes coming from the busy road outside? Those hazards are just as important to kids' safety and health, and they're just as important to be aware of and manage, so we're starting to pay more attention to them. We also think about how to keep kids healthy in child care with things like hand washing or sending them home if they have pink eye or strep throat. But we also need to think about how their environments might affect their development and their lifelong health. And Hester will share some pretty alarming examples of how chemicals in the child care environment can impact a kid's health both now and in the future. As with so many aspects of child care, CCAoA considers child care resource and referral agencies to be critical partners in promoting safe child care environments. To better support our members, we've put together a series of resources and activities to help you get started. Throughout April and May, we'll be publishing a series of blog posts and an ebook to cover 4 areas of environmental health and child care and give you a variety of suggestions for how to promote healthy environments through the work that you're already doing with parents, providers, and policymakers. This webinar is another key piece of the series, so bringing in national experts from the Children's Environmental Health Network to tell you more about what's going on and how you can get involved. And finally, we're developing and sharing some ready-to-go resources that can help you promote healthier childcare environments. We've updated our childcare checklist to include some environmental health tips and questions, and I'd encourage you to check those out. They're available on our website right now. We're also working with CEHN to promote their EcoHealthy Childcare program for providers, which Hester will talk a little bit about. And I just encourage you, as we move forward with Hester and Maggie's presentations, and as you look through the resources that we'll be putting out in this member series, I'd love for you to just think about what more CCAoA could do to get you more involved in safety in the environment and the way that we're thinking about it. With that, I'll just turn it over to Hester.
Great. Cathy, can you hear me?
Yes.
All right. Wonderful. Thank you all for joining. We're just going to go ahead and get started. So next slide, please. All right. So the overview for my presentation, which will probably be about a half hour or so, is to tell you a little bit more about Children's Environmental Health Network, about our EcoHealthy Childcare program, which is a program that focuses exclusively on early care and learning settings. And then we're going to look at ATSDR, or the Agency for Toxic Substances and Disease Registry, which is a portion of the Center of Disease Control and Prevention. We're going to learn more about their program and their guidance around choosing safe places for early care and education. And then we're going to look specifically at some collaborative efforts of work that is currently happening with some specific states. So just an overview so you get a little bit of a backdrop. Children's Environmental Health Network is a national nonprofit organization based in Washington, D.C. We've been around for 28 years. And globally, the organization is very much working on multiple levels to support and protect children's environmental health. So most of the work that we're doing is focusing on young children, but obviously everything that's applicable for a young child is also applicable for an older child. Also, we want to be thinking about people who are pregnant and have babies in utero, because that we know that there can be some toxic exposures experienced when babe is still inside mom. So Children's Environmental Health Network works to promote preventative research. We work with toxicologists, researchers, pediatricians, public health leaders to all come together and basically follow the research, follow the science, distill it down, and turn around best practice advice or guidance. And in the case of EcoHealthy Childcare, we're trying to take all this science and distill it down to be able to relay to childcare professionals, whether they be trainers or health consultants, licensing staff, or direct service providers, what are cost-effective, realistic strategies that you guys could be incorporating right away to protect the overall health and well-being of children, focused specifically on children's environmental health. So children's environmental health, generally I like to start with this slide just to make sure we're all thinking of it in the kind of the same way. We want to think about anything that is outside a body or a human or a child. So what is any kind of chemical that is on the exterior of a child or an adult, and how might that chemical be affecting the health and wellness of that person? So if we think about it, what is the air that they're breathing? And Jessica kind of mentioned about, maybe what is there idling happening in parking lot? Is the child care facility located in an urban setting where there might be a lot of exhaust, more so than a rural setting? So is the air clean? Are we spraying things around a child care facility or within the play yard that might be unsafe, such as bug repellent or sunscreen? What kind of lotions are we putting on children's skin, or chapsticks? And then thinking about also what they're consuming. So where is the water coming from? Has it been tested for lead? And also thinking about food variability, for example. So for adults, we're eating a plethora of different things. For a young child, they're not eating so many different things, and they're especially not if they're in those really early years or that early year when most of their diet is probably either breast milk or baby formula. So is the water that we're using to create the baby formula water that's been tested and found to be healthy? So ultimately, we want to think about all of the different possible exposures that could be occurring, and how do we make smart decisions, and how are we thoughtful so that we can protect the overall health and well-being of children. We know that President Obama's cancer panel, for example, released a report estimating that about 30% of cancers have some kind of environmental component. And so the evidence and the research continues to grow, and we ultimately want to follow and make sure that we are combating the adverse health effects that are a result from exposures of harmful chemicals in our daily exposures. So EcoHealthy Childcare has been around since 2005, and the program kind of went national in 2010. And we work in a variety of ways, but put simply, we want to support and partner with childcare professionals at all levels in helping them discern how can they make easy, realistic, and cost-effective changes within their environments right away to improve or better protect the health and well-being of children. So everything that we kind of suggest as a best practice is science-based or empirically derived. We put out an endorsement, which is a checklist that's a self-audit. A child care professional or a facility can go through and try to comply with 24 of 30 best practice items. And if you do and have the required kind of validation signatures from somebody who doesn't work within your facility, then we will endorse you for 2 years, which is a way to publicly and professionally acknowledge the work that you're doing that goes above and beyond what's required by your child care licensing regulations or your state quality rating improvement system. We also create a plethora of free resources, and those can be found on our website, and we'll share those links later. But we have about, maybe 17 different fact sheets. Each fact sheet would be focused on a major area of environmental health, such as lead or mercury or plastics or air quality. We have many different frequently asked questions that are developed in a way where they are very attractive. They have photographs on them. They can all be printed off as a PDF. And these answer specific questions that have come in from you all. So should I use the combined bug repellent with sunscreen? The answer is no, but we talk about that kind of thing. Or what kind of mattress should I be looking at, or what should I be thinking about when I'm choosing a mattress for my child care facility? So there are many different resources that we encourage you to download and not just use for yourself, but also just distribute them to the parents that you're serving. We provide technical assistance. If you have specific questions, we welcome them through email or phone. And then we have developed a 5-hour training curriculum that so far has been delivered in 33 different states. We have an online course, and then we do webinars such as this to try to share the information we have with you all. So children are not little adults, and let's just take a moment to think about that. We know that they have higher exposures to toxic chemicals, and that's because of many different things. The first thing is that their bodies are smaller than ours. And if you think about maybe how much you've changed as an adult in the last 6 years, you probably haven't changed a lot physically. Maybe you've gained or lost a little bit of weight. Maybe you have a little bit more wrinkles on your face, right? But for children going from the age of 0 all the way to 6 years, which again are kind of our focus age for this program, there's an extreme amount of development with their physiological bodies, and also like just simply looking at their cognitive ability or their neurological development. And so because they're going through this extreme window, it's a very important time to protect what they're exposed to. And exposures aren't just what you're exposed to, but it's the duration that you've been exposed to something. It's also how much of that chemical might be around. And it also matters about the window in which you're exposed to something. So what time were you 1, were you 3, were you 25? So how old were you, how much of it was around, and kind of how long was that exposure taking place? We also want to look at their behaviors. So children crawl, they sit on the ground, they're rolling around before they learn how to crawl or walk. And so just thinking of the example of the carpet, if you have wall-to-wall carpet in your home or in your child care facility and a child is sitting down, then that right there is something that we can use as an example. If you have any kind of toxic chemicals that are used as an adhesive or a glue to hold that wall-to-wall carpeting down, they could be breathing in those fumes. Also, no matter where you are in the country, you could ask somebody, what's it like when you pull up old carpet? And no matter how well you're trying to do to keep it tidy, you can pull it up and realize it's pretty nasty underneath because it's this congregation of dust and dirt that settles down with anything that's ever been sprayed in that room. So thinking about household chemicals, if you've sprayed something once and there aren't windows in the room and there's not a good ventilation system, then it's all trickling down and kind of getting caught within those fibers of the carpet. So if a child is sitting on the carpet and spending a lot of time there, that right there is a different air quality than the height of a person who's, say, 5'8" or 5'6". They're actually breathing in different air quality depending on where they are and what their stature is. Finally, we want to think about their behaviors with hand-to-mouth behaviors. Typically, you're not thinking of an adult as putting things in their mouth, but we know that this is very much developmentally appropriate for young children as they're learning about things and discovering them and trying to learn more. Finally, kids proportionally eat more and drink more and breathe more pound for pound than an adult. And that's simply because they're smaller. If you think of a typical child, you might feed them a large meal, and 2 hours later, they're starving again. And for us adults, we can go longer between meals. Also, their lungs are smaller. They breathe more rapidly, and so therefore they're taking in more air than an adult would. So just in summary, we know they're more vulnerable because their organs are still developing, their metabolism is not as efficient, and early chronic exposures pose a greater risk because ultimately there could be many years in which to become sick, especially if that child has had those exposures for many years. All right, so children's environmental health and child care facilities. What we know generally is approximately 13 million U.S. children less than 6 years old spend some time in early childhood education facilities where they may be exposed to potentially harmful chemicals during critical periods of development. So we know this from research. We are hoping and supporting more research coming out, but what we know is that this is a true fact. So we know that children may experience chronic exposures during critical windows of development. We talked about that just previously. And we also know that child care generally has been overlooked as a key area where we need to put more time, energy, and dollars into protecting these young children. So comparatively, there are many programs, federal and state and local, that focus on schools and trying to reduce toxic exposures or maybe lead in water in schools, and that's all wonderful. We don't want to take away from that. But what we know is that there's not enough resources, time, and energy focused on early care and learning facilities, and in some ways you could argue that these children are more vulnerable and it might be even more important to protect these little guys because of their kind of extreme phase of development that they're in. So we're working on this issue. Many of our national partners, national child care organizations and environmental health organizations and associations are working on these issues. But the more that you guys can do to take these resources and simply distribute them and this information to the colleagues that you have or the parents that you're serving would be very helpful, because we want people to realize environmental health is a greater component to general health than people have previously maybe appreciated or realized. So child care professionals are generally, we know, not receiving enough education nor training on environmental health, and we certainly know that there's environmental justice issues too. By that, what we mean is there are folks in the country that are exposed to more chemicals just by place of where they're living, and maybe it's in a lower socioeconomic status area, and so maybe they're closer to a factory. So they, in and of themselves, are closer to chemicals. That often corresponds with minorities, and so we have environmental justice issues of minorities often being exposed to more toxic chemicals than others. And so we want to be really conscious of protecting all children regardless of where they live. All children are important and they need to deserve equal opportunity to excel in school and have good health. We also want to remember, like mentioned before, that all of these best practice suggestions or this advice about protecting environmental health is not just important for the children that we're caring for, but it's also important and applicable to the providers who are conducting the care. We know that the majority of the workforce for child care or early care and learning are females. We know that they are in childbearing years, and so also we want to protect any children that could be in utero for the providers that are working within these child care facilities. So now we're going to get in specifically to the topic of safe siting. So to make sure we're all on the same page, safe siting or choosing safe places is ultimately thoughtful consideration about where or where not to locate an early care and education program. So just to be clear too, the guidance and the programming that's coming out of ATSDR is currently focused on center-based facilities. We're hoping in the future that we can turn around and adapt it some for family child care providers, but I just want to put that out there, that the focus right now is for center-based child care facilities for the guidance that's being put forth by ATSDR. So we don't want a child care facility to be too close to or in too close of approximation to dry cleaners, nail salons, gas stations, hazardous waste dumps. We also don't want a child care facility to be located in a building or in a room that was previously used for something that would be seen as an unhealthy exposure. So the ultimate goal of safe siting generally, when we talk about it, is to ensure that environmental health hazards are addressed so that children are protected. And ideally, we would be doing this research and sussing things out prior to a child ever joining a child care facility or prior to a child care facility ever being housed within a specific location. And that's kind of obvious, right? If we can take care of it before a child care facility is located in a specific area, that's much easier to deal with versus afterwards, after a child care facility is already there. So the Agency for Toxic Substances and Disease Registry, or the acronym ATSDR, is working to protect communities from environmental health threats through the application of state-of-the-art science. So ultimately, ATSDR is focused on facilities where early care and education programs operate, including child care centers, daycares, preschools, nursery schools, Head Start facilities, early Head Start facilities. We're looking at for-profit, nonprofit, and publicly funded programs. So all to say, however you want to coin it, we usually refer to it as just child care or early care and education. All of these programs is what ATSDR is focused on. And ultimately what we want to look at is how can we help identify problems, and then also how can we be proactive instead of reactive in making good choices from the beginning and where a child care facility should be located. So Choosing Safe Places for Early Care and Education is the formal name of the ATSDR guidance and program. Sometimes people refer to it as just Choosing Safe Places or Safe Siting. So if you hear that terminology, it's kind of all the same. This program was launched in 2017 by ATSDR. And the mission ultimately, like I said before, is to ensure that early care and education programs are located where chemical hazards have been considered, addressed, and ruled out or mitigated. There are 25 apple tree states, we'll look at that slide in 1 minute, where these states have received specific funding from ATSDR to ultimately assess what's going on within their state and to develop and pilot and launch programs or initiatives or tools around safe siting for their specific state. Right now, ATSDR has some national partners, so Children's Environmental Health Network, we're one of them. The National Association for City and County Health Officials, or NACCHO, is a partner, and the Environmental Law Institute is a partner. And we're all coming together to support these 25 states in better understanding kind of the lay of the land and the nuances of the child care landscape, kind of who's who, what's what. And for those of you who have been in child care for a long time, you know that it's kind of a nebulous world. So this is the state right here of the 25 funded states. And so just to reiterate, we refer to them as apple tree states, but ultimately these are the 25 states right now that are funded. It's a 3-year program. We are just beginning the 3rd year for these states. And in these 3 years, their job was to assess what was already happening around safe siting, to figure out who major players were within their state, whether it be licensing or health department folks or maybe quality rating improvement center folks, and then also figure out what kind of initiative or program would work within that respective state. And we know all 50 states have different child care licensing regulations, so part of our job is to share information between the states and encourage them to do so that best practices and lessons learned can be shared so that we can save time, and then also things that maybe aren't working so well can be avoided for the next state. So now we're going to change a little bit and look at some examples so that it makes more sense and can be brought to life a little bit more of improper siting of a child care facility. So this is kind of a famous example, which is a little unfortunate, but sometimes these traumatic experiences or lessons learned are beneficial in moving the needle forward. So in New Jersey, there was a child care facility called Catty College, and it was basically a facility that was located within a former mercury thermometer factory. So just stopping there for a moment, within the Children's Environmental Health Network EcoHealthy Childcare program, we talk to childcare professionals about mercury and about the fact that even the mercury in a tiny little thermometer, if it were to break, would be devastatingly harmful, really, to children if not cleaned up properly and if the vapors were kind of released over time. So that's one thermometer. We also talk about mercury being found in other things. But if that brings to light how this is largely a problem, right, if it was a former mercury thermometer factory, meaning obviously there would have been a lot more exposure to mercury than just the breaking potentially of one thermometer. So ultimately, because of this situation, New Jersey has now become a leader in creating a safe siting program, and that's when we're going to hear from Maggie at the end of this presentation. But following the discovery of mercury contamination at this child care facility called Catty College, being located on the site of a former thermometer factory, the state of New Jersey put in place a variety of legislative and regulatory reforms aimed at identifying and addressing environmental health contamination before it's licensed for child care use. And I think that that's what's key here, is we want to figure it out at a time when people are already looking through and kind of crossing T's, dotting I's, and making sure that all the regulations are being met. So under New Jersey's child care regulations, at the time of an initial application for license renewal, or facility relocation, a child care center must submit to the Office of Licensing an approval from the State Department of Environmental Protection indicating that no further environmental remediation is needed for the site on which a center is located. So ultimately here, what we've learned with New Jersey and their approach is before you can even attain a license for a child care facility within a location, you would need to go through an assessment to make sure that there aren't any potentially devastating environmental health contaminants. Looking at another example of improper siting, this is within the state of Wisconsin. And this scenario was one where within a strip mall, there was a co-location of a gas station and a store and a child care facility. And over time, what we found was that child care workers were complaining of a strong gasoline smell. Obviously, there was some vapor intrusion. So indoor air samples identified that benzene concentrations were consistent with ultimately a problem. We know that benzene is associated or correlated with increased cancer risk. We also know that that was leading towards a possibility of a fire or explosion hazard. So ATSDR came in and ultimately recommended that the child care center relocate until action was taken to ensure that vapors were not reaching the daycare. And so some of you guys might be thinking, oh my gosh, I can't believe it, if you had to move a child care facility and going through kind of that upheaval and that change for several weeks. But ultimately what we want to think is that would be a short-term inconvenience that would well be worth the long-term goal, which would ultimately be decreasing any of these toxic chemicals that could very much negatively impact the health and well-being of these children, not just at their young kind of age, but also for the rest of their lives. So this graph right here helps us discern a little bit more the types of environmental exposures that could be occurring. It's kind of helpful, I think, to think through. So I'll just walk us through a couple of them. On the left-hand side of your screen, where it says the exposure point is dermal or ingestion, and the kids are kind of playing next to the playground equipment. So what we want to think is, for example here, what might be living or existing, I should say, in the soil of the play yard or a playground where children often visit? Has the soil been tested for lead? So that could be one thing we could be thinking about. Within EcoHealthy Childcare, we think about for the playground equipment, does it have arsenic in it? Because often CCA was used as basically an insecticide to keep insects off of the wood. And so when children are playing on a wooden structure from prior to 2004, could they be exposed to a chemical that way? So we want to think about dermal contact, and also we know kids are not always washing their hands between playing in the dirt or playing on a structure and then eating their peanut butter and jelly sandwich. So that would be ingestion as well. If you look at the bottom on the left-hand side where it says a release mechanism of site leaching, so this is showing the example of if you had any kind of incineration or if you had a factory and pollutants are coming out and ultimately seeping into the ground, not only are the chemical exposures then being found in the ground that could cause exposure to children, but it also could be leaching further in the ground, going down into our groundwater. If you follow the bottom of the screen from the left to the right, you see that groundwater eventually could be a problem because it's transporting the chemicals, and then you follow up to the top of your screen on the right-hand side, and you see the exposure point could actually be somebody drinking the water, which is why, again, we kind of started the webinar by thinking about whether or not water has been tested for lead, because that would be an exposure point for chemicals. So I could go into more time here, but I don't really have it. I could go into more details here, but I don't have enough time. But ultimately, you can see here, there are many different ways that we can be exposed to these different environmental contaminants. And so we have to be very thoughtful about not just what the building maybe was previously used for, but also how close are we to something. And one thing I didn't mention before is funeral homes is another one that we want to think about, just because of the chemicals that are used within those facilities. So what's a national estimate of the problem? So how big is this problem? People are wanting to know. And for many early care and learning professionals, this is kind of a newer topic. And so we recognize that, and we're hoping to just continue to share resources and conduct webinars so you guys are more and more familiar and thinking about safe siting. But using GIS data, we found, ATSDR found in the United States that out of approximately 115,000 child care facilities, about 76 are around potentially contaminated sites. So that's a pretty large percentage. The good news, though, is that once, that's like a general estimate. And once you distill in further, we find that really it goes to a much lesser percentage where people would actually be at the point where they would need to do mitigation. So this is where it's a potential contamination of site. Folks need to go in and do an assessment and think about whether or not there is vapor intrusion or whether or not there is leaching of chemicals into the soil or the water of the child care facility, and then move forward from there. But just looking at an example, so of the 76%, about 15,000 of the 115,000 were, these are child care centers, were within 50 meters of a major air emissions source. So maybe looking at roadways, for example. And so that's how that number came to be. The location information on the child care facilities was from the latest Homeland Security Infrastructure Program, and that was from 2014 data. And the data set only includes center-based child care locations, which we talked about earlier, including schools and religious institutes, and does not include group, home, or family-based child cares. Also, what we want to say is proximity or closeness to something does not always mean exposure to contaminants. So it's much more complex than that. But as a starting point, if we think we might have a problem, the best thing to do is spend more time assessing it and researching it. So now we're going to look at a little bit more of some state examples about how folks are preventing environmental exposures. So since 2007, some states have enacted approaches to help protect children, and specifically we're going to look at New Jersey and Connecticut. So again, New Jersey put into place new licensing regulations, which we learned about formerly, and if the building was ever classified as a factory, industrial, high hazard, storage, dry cleaners, nail salons, gas stations, or funeral homes, then they would require an indoor environmental health assessment performed by a licensed indoor environmental health consultant. From Connecticut, we realized that they have developed a very successful program that is not related to child care licensing, and they did not change their state licensing regulations, but they have come forth with a very productive program, and we'll look at that specifically too. So in New Jersey, as we said before, you must obtain a site remediation clearance through the State Department of Environmental Protection, which generally requires a kind of a preliminary assessment of the property. The applicant must also certify whether the property was housed using certain past usages. So really thinking about what was this building or this room used for previously. In cases involving certain past usages or pre-1979 buildings, a safe building interior certification may be required through the Department of Health. And new child care regulations prohibit siting centers in former dry cleaners or funeral homes for the point that we're making, because the type of chemicals that are used in that industry are not healthy for long-term exposure, and definitely not for young children. So now looking at Connecticut, this is very interesting to us, not only because it's very successful, but because it's non-regulatory. So Connecticut has a non-regulatory approach to addressing environmental site hazards. They refer to their program as the SAFER program, and it's the Child Daycare Screening Assessment for Environmental Risk Program. It's always kind of a mouthful for me. But they initiated by the Department of Public Health in 2010, and ultimately it integrates a variety of elements. So they cross-check various state databases for known environmental hazards. They use child care application forms to request information about potential site hazards. The forms and training for inspectors are used to identify potential hazards. And then there's technical assistance for addressing identified hazards. So it's not mandatory, but it's really just setting up a system or the forms in a state so that people are requesting information, and they're kind of supporting the process of checking the boxes and making sure various things are looked into. Connecticut is the earliest and the leading model for a non-regulatory approach to addressing environmental site hazards, and they have been key actually in this Choose Safe Places work, because many states are turning to them and learning from their strong example of how to move a program forward. And we have seen other states such as Pennsylvania also been trying to develop voluntary initiatives with similar elements. So the objectives for ATSDR Choose Safe Places are generally to develop a guidance manual for safe siting for early care and education programs. The guidance manual has already been developed and released more than a year ago, and we'll share that link here in a moment. To develop materials for how to build a program for safe siting. So again, when we say the word program, that's not meaning a child care facility, that's state specific. How do you develop an initiative, maybe is a better word, for working with partners and putting into place programs or initiatives to move forward the idea of safe siting so that we can protect kids from the long term and thinking about what a building used to be used for or what is it in close proximity to. We want to include safe siting considerations in licensing at the state level if possible. Obviously, every state is going through an update of their child care licensing regulations at kind of different, is it every 3 years, is it every 5 years? But that is the ultimate plan in the long run. We think that that would be the most successful because it has the greatest longevity of improving change. I think they want to include safe siting considerations in federally supported early care and education programs, so maybe just looking for an example as at Head Start or Early Head Start, and then also implementing safe siting considerations by accrediting organizations and large-scale operators. So an example of that would be working with the National Association for the Education of Young Children, or maybe the Association for Early Learning Leaders. These are national accrediting bodies, to embed best practice standards pertaining to safe siting within these accreditation bodies, so that if folks want that acknowledgement of being NACE or AEL accredited, then they would have to comply with certain safe siting programs and regulations. So the Choose Safe Places guidance manual explains the problem of being located in close proximity to or within an older building that used to be housed for something that would be unsafe environmentally. It defines what safe siting actually includes. It explains the elements of ensuring sites are safe and describes how to build a program. The 4 key safe siting elements are to pay attention to the former use of the site that might have left harmful substances, the migration of harmful substances onto the site from other sites or nearby infrastructure or activities, what's the presence of naturally occurring harmful substances, and then the 4th thing is finally access to safe drinking water. So looking here at some examples of a past use of a site, these are images that are hopefully helpful to you, but on the left-hand side of the screen, we're looking at a brownfield site in Massachusetts where ultimately the soil and groundwater contained contaminants. that were problematic. And so this is an example of a past use that was leaving behind environmental contaminants. So we would want to be very thoughtful about whether or not that land should be used for a child care facility. On the right-hand side is within Connecticut, and it's a picture of ultimately a building that used to have mercury, asbestos, and metal. And so is this really, right, posing the question, the best location for potentially the use of a child care facility? Likely not. So we want to think about what were the previous uses of land or of a building prior to putting a brand new child care facility in it. So these illustrate some ideas of nearby sites, the proximity to something that could be problematic. On the left-hand side, we're looking at pesticides that were being sprayed. So the example I always give is just thinking about California. In Central California, we have a large agricultural area. And so for folks that are living there or working there, we want to be really thoughtful about what pesticides might be sprayed and how could we just, if we are located there and we're not going to change that, how could we be very thoughtful about closing windows at certain times of the day or opening windows at certain times of the day to decrease exposure. But again, that would be an example of vapor intrusion or just the pesticides negatively impacting the outdoor air. And if it goes inside and you close the window, then it's impacting, right, negatively the indoor air quality of your child care facility. On the right-hand side, we're looking at the example of a dry cleaner business. And so we've seen in obviously some other states you cannot even have a child care facility if it was formerly used for a dry cleaner or a nail salon. But again, the chemicals that are used in these processes are not helpful for humans, let alone young children. Here we're looking at naturally occurring contamination. And so in the guidance manual that we were referring to, we are looking at examples of naturally occurring contamination. And here we're looking at nitrate contamination to shallow groundwater. So could that be affecting what exposures children have to this water? And then also within the manual, we look at the actions that can be done to identify sites with naturally occurring contamination. So the fourth thing was access to safe drinking water. And within the manual, it defines many different types of drinking water systems and also describes actions to ensure that each type of system is safe. So how do we make sure that the water that we're providing to children at home or in schools or in child care facilities is of the caliber that should be consumed and not be negatively impacting their health and development. So how do we build a safe siting program? Ultimately, we are in each state encouraging folks, and they're doing it on their own anyway, to just build partnerships with the people we said before. So we want to be working at all levels with local, state, and federal and thinking about who are the health departments, who are the child care resource and referral agencies that could be helpful in pointing the finger to different entities that could be supportive in providing resources or advice. Also looking to licensing, quality rating improvement programs, national accreditation. There's many ways that early care and learning programs and associations and staff can be very involved in moving this needle forward. We want to identify problematic sites, and obviously we want to follow up on those sites and conduct mitigation if needed, or sometimes much less is needed. We don't have to think of the extreme example of where you would actually have to move children out of a child care facility. That will need to be done sometimes, but the percentage of that is very low. And ultimately, we want to provide education, outreach, and awareness just generally about safe siting so that folks are more comfortable and aware of what this term means and thoughtful about new child care facilities and where they should be located. So in the interest of time, I'm not going to spend time on this graph, but just kind of illustrates what I just said and thinking about all of the different parties that can come together in each state to really support the positive and kind of fast improvement of developing initiatives and programs around safe siting. So looking just specifically at Connecticut, what were their programmatic successes? And this helps to illustrate to how many facilities you look at and how many actually have to have kind of extreme support. So since 2007, there were 46 potentially problematic sites that were referred to the health department. 10 of the 46 required additional data, and only 5 of them had contamination that required further action. And so we kind of look to this as an example of what would be likely in other states. So we don't want to freak everyone out and think that 76% of child care facilities have an issue. That's very much not likely, but it's really starting from kind of a wide net and focusing down to make sure that we identify those sites that do have problems that do need further support. So the Connecticut success story example is ultimately what we talked about before, but this is looking specifically where there was a business and a child care center that were next to each other. They were both on an area of former agricultural land, and we found basically that the business's property was part of a state-regulated cleanup program, so they had support, but the child care facility that was adjacent or right next door wasn't covered under the regulated cleanup program. But ultimately, the Connecticut Safer program stepped in and supported the child care facility so that both of them were protected from the contaminated soil. So this is just looking a little bit further at the work that we're doing within Children's Environmental Health Network. And so just to reiterate, we are providing technical assistance support to these 25 states and helping them understand who's who and what's what within the child care world because it's fairly nebulous. We're actually working with the National Resource Center for Health and Safety in Child Care and Early Education to update and make more comprehensive the standard for environmental site assessments, and that's 5115, and that's within caring for our children. So that's pretty monumental work, I think. We are developing a safe siting fact sheet and frequently asked question that will be distributed through EcoHealthy Childcare so that folks are better informed of what this work means. We have done some training specifically in some states where we work with Choose Safe Places folks, such as we just did in Colorado, to pull together a lot of licensing staff, health and nurse consultants, and trainers so that everyone came together and understood children's basic environmental health considerations and then honed in more specifically at safe siting. We have an e-learning course that we encourage you all to use. It doesn't cover safe siting, but it's a 3-hour course that has been approved for adult learning clock hours in 48 states and ultimately provides a very good basis for understanding what is children's environmental health and why should I be concerned and what can I do immediately. And then ultimately we're all working together for Choose Safe Places to present on some panel presentations at the American Public Health Association, the National Environmental Health Association, and then the National Association for Regulatory Administration. We've only yet been accepted to NEHA, and we're waiting to hear from APHA and NARA. Okay, these are just some links to resources should you need them, and we will be sharing the slides after the webinar. This is a tool that you guys can download that's all about kind of planning so that we can set it up safe for child care facilities. Here's contact information for ATSDR should you be interested in reaching out to them directly. This is contact information for myself, and now I'm going to hand it over to Maggie Lopez. Thank you.
Hi, Maggie. You might need to unmute yourself by hitting *7.
Thank you, Hester. Am I on now?
Yes. Yep.
Perfect. Thank you. That was great, Hester. Thank you, Jessica. Thank you, Cathy, for having me. It's such an honor to be part of this presentation. As we go on with New Jersey requirements, and it's unfortunate that the state of New Jersey had to experience what it had to in order for it to implement what needed to be implemented. And like we all saw in Hester's presentation, so detailed an aspect of the environmental hazard that children face. And every one of us are individuals that have the passion for working with children. And our primary aspect of things should really honestly be that health and safety before anything. So most definitely having these requirements in licensing has put us a direction for the state of New Jersey that is quite interesting in many aspects. Not only do we have the list or the checklist that we need to follow to make sure that we are in compliance with these hazardous environmental situations, but every 5 years as we renew our licenses, we need to make sure that we are also in compliance. So as you see here, we make sure that our facility, our factory, we make sure that there's the toxic, the compulsive materials, the storage, dry cleaners, and so forth. So before even starting, we need to make sure that we are not in a facility that entails any of this situation. I want to talk about how we support our providers. Because once we go ahead and process and we go through licensing and we renew our licensing, one of the things that we come across and one of the things that we as a CCNR, what we tend to do, we support our providers by helping them. And one of the two agencies that we have what's called GrowNJ here in the state of New Jersey. We also have New Jersey First Steps. GrowNJ works primarily not only with preschool but also with early childhood, infant and toddlers. But New Jersey First Steps focuses on infant and toddlers. And what we do is we work with the directors and we work with the teachers in the centers and also in home care, family care, in making sure that they're providing quality. And we do this through mentoring, coaching, and observation, and following certain checklists in ourselves too. And one of our primary jobs working through GrowNJ and New Jersey First Steps is making sure that this is also being implemented. And we support these directors and we support these family care providers in doing so. We also have Partner Up as one of the things that we do here at the CCNR in Monmouth County is we have Partner Up with training institutions or agencies that do trainings to provide trainings in environmental or hazard components. Not to say that we have challenges. One of the challenges here in the CCNR faces, besides the fact that getting the individuals to come to our professional development in sense that relates to the specific topic. Most of our participants come in for, and we all know those who go into training, most of the times they go in because they have to meet that professional development. But in reality, we want to be able to enhance and have them understand the reasons why safe and healthy environment or safe and health environment is very crucial to the children they're working with. So that is one of our challenges. But a second challenge that the state of New Jersey is facing, and I'm very passionate about this particular component, is the fact that, yes, we do have this enlisted for the child care centers. From the moment they start and begin and open their centers, they have this checklist they have to go through. They have to make sure they have the particular rating test done, the lead test done, the water test done, and also asbestos test done. So all this is well required in a child care center. But what we seem to be lacking is where it's in the family care setting. We don't have that quite established in family care. And I, being an individual who have worked both in North and Central Jersey, and having worked not only in centers but also in family care homes, this is something that I myself find to be a big major concern in wanting to see how we can extend this not only in child care centers buildings but also in the homes too. I'm an infant and toddler specialist for New Jersey First Steps. So many family care providers provide services for infant and toddlers. And my concern is that so one of the things that we do provide with the GrowNJ and New Jersey First Steps is that when we do step into these homes or step into these centers, we make those observations. We work with the center providers, we work with the family care providers, and we try to guide them, mentor, and coach them into what is appropriate and what is not appropriate in sense of safety and what's healthy for the children. One of the aspects of challenges we have for the providers when it comes to renewal, I myself worked in a very old building as a director for many years at Northern New Jersey. And one of my challenges as a director there was the aspect of the cost that it takes to have all these testings done. But one of the things we do ourselves as an agency now, and I know as a support we have for them, is that we encourage the directors, because we do it every 5 years, is to make sure that they start the process with time. We have to set appointments for testing to come in to test the buildings, especially if my particular building was built in 1902, so it was past 1979. So specific kind of testing and the cost of those testing had to take place. And some of these inspections and fees, besides the fees being expensive, were the time. And it would take time for them to come in and do these inspections. So encouraging directors, finance providers don't, but encouraging directors to come in and start the process way before licensing was due was something that we do and through GrowNJ and New Jersey First Steps, making sure that they're starting the steps and moving forward to follow and not fall behind with extension. Having said that, I do want to share with you one of my experiences that I've also had besides the state of New Jersey. I know it's not in our PowerPoint, but I do want to talk about the state of New York. I have had the privilege of working in a very, very low-income and challenging world in the city of New York City, which is the South Bronx. And what I did there was family care. I was working with family care. And I do have to say, considering, and I did help a lot of individuals set up their programs in South Bronx, family care providers, the state of New York does require, before you begin, to have your water tested and to have your besides water, your fuel tested also. So that was one of the requirements we had in the state that exists also in the state of New York. So having said that, that is something that I'm hoping we can also move forward with here in the state of New Jersey, not only in the state, in the centers and for providers and directors, but also for family care providers, because children, regardless of being in a center, being in a home, we need to make sure that they're in an environment that they feel safe and healthy, that the environment is healthy, from the water to the paint on the wall to the air they're breathing. And that's the most important aspect, besides, of course, nurturing and providing for their full development, is make sure that we can have that. And I want to thank you once again for having me here. It was an honor to be part of this group. Thank you.
So if folks, again, if they have questions, you can submit them to the chat box on ReadyTalk. I do have one question that came in. It was related to, Hester, your presentation. They had a question specifically about the distance that a child care center might need to be from a funeral home or a dry cleaners. They were asking, how far away does a center need to be from a funeral home or a dry cleaners? I don't know if you wanted to take a stab at that.
Yes, can you hear me?
Yes, I can.
Okay. So thank you for that question, and whomever asked it is hitting on one of the most difficult points. And sorry?
I sounded terrible.
Oh,
did I sound
sorry.
terrible? I got nervous.
You want to mute everyone else?
Did you hear me? Was I repeating?
The conference has been muted.
Can you hear me?
Yeah, we can.
Okay, great. Sorry, you guys. So what I wanted to just acknowledge is that is a very key question, and it's a difficult one to answer. And there isn't, to my knowledge, specific metering that I can tell you. And when we have been going through this most recent iteration of updating the Caring for Our Children standard on environmental site assessments and audits, we have the word nearby, and we are currently in that phase of looking to ATSDR for some guidance about how do we define the word nearby to make sense, knowing that it's going to be different for every state and in every location depending on a multitude of factors. So I apologize for not being able to give a better answer, but I think that the short answer is we acknowledge that that is what people would want to know, and I think the best answer is that it would be a case-by-case analysis of having someone come out once you realize that you're in that point where mitigation or some other change needs to be made, and then we would be looking to experts within the health department or otherwise to help us discern how close is too close.
So there was just one other question. It was from a home child care provider, and they're asking who would they contact to have their soil tested? And also, besides the soil, what agencies would they contact for all the testing needed? And again, this is from a family home provider.
Okay, so given that we don't know the exact state, and not even if you told me the state, I don't know if I would know the answer, but what we have encouraged is if you're a family child care provider or center-based, then I think there are two different things you could do. You could either just go to your child care resource and referral agency and say, could you tell me the actual person or entity that you think I should contact when I have concerns about environmental health issues, or you yourself could look into the local or state health department and just pose that question, because again, it will differ depending on what you're talking about. So if you were talking about radon mitigation versus lead testing for, in your water or in your paint, these are all different entities of who would come forth and support that process. So I think the best step would be to go to your CCR&R and just ask them who you should be contacting, or go to your local or state health department. A third option could be going just to your EPA regional office. There are different regional offices around the nation, and you could go to them and they might be able to pinpoint specifically who you should call.
Okay. Do we want to take one more question, Hester?
Sure.
Okay. So this is about, someone had a question related to city or county land use planners. Are you doing anything to require or encourage city or county land use planners to proactively help providers find healthy locations?
So I think that answer is dependent on what each state is doing to develop their program. And Kathy, you feel free to say if you know, because Kathy's working on all of this too. But my understanding is some states are looking to build those connections and other ones might not be there yet. So each state is the end goal is the same for each state, right? How do you develop a program or initiative so that this is part of normal assessment of a child care facility before somebody can open a facility? But every state has the autonomy to go about it in a different way, and that's because they all have different resources, programs, and kind of leading organizations. And so I think that's very much dependent on how that specific state would be approaching it.
Great. That's all the questions I had in the chat box.
Okay. Well, thank you guys for joining us. We will be sharing a recording of the webinar. Thank you very much to ChildCareAware of America of co-hosting this with us. We know that we had over 200 people register for this webinar, so clearly it's it's a topic that is of key interest to folks. And we also want to thank Maggie Lopez, because it's very important, I think, and beneficial for you all to hear from one of your peers from a child care resource and referral agency. So with that, we'll close out, and we thank you for joining us.